Primary care and a good family doctor seem like a given in modern medicine, but for millions, access to care is nothing more than a pipe dream. With the Affordable Care Act, millions of patients received access to insurance, but that didn't mean access to care. In fact, it has exacerbated an entirely different problem. Now, millions of hardworking Americans are finding that they are underinsured as insurance premiums rise and deductibles skyrocket. There's also a growing shortage of primary care physicians to care for these patients, a product of growing overhead cost, reduced reimbursements, increased and overly burdensome regulations, and frankly, a system that just can't keep up with the growing demand. One answer is the Refuge Clinic. This clinic serves those in central Kentucky and surrounding areas. As an outreach of Southland Church, it has filled a growing gap in the U.S. healthcare system. Rachel Smith is the executive director of the Refuge Clinic and outlines the vision and mission of the clinic.
I serve as the executive director, and I've been fortunate enough to be here from the very beginning. So about 9 years ago, there was a vision that we wanted to take the church outside the walls and respond to the needs in the community. And at that time, I was able to come on and help out kind of creating the clinics and seeing what the true need was in the healthcare arena at that time. And so that's kind of been my role ever since.
Whereas there are options for those on both ends of the income spectrum, a growing need is those working-class, blue-collar Americans that may be making ends meet, but not to the point that they can keep up with the growing costs of the healthcare system.
The Refuge Clinic exists to treat the community and the needs in the community. And so when we started about 9 years ago, there were millions of people that were uninsured, and at the time it was really challenging to find a provider and to be seen and to be treated at a costly, affordable rate. Now we saw with the change of the Affordable Care Act, we were excited and we were like, oh, there's an opportunity here for people to receive care, but then the issue switched where it was access to care. There weren't providers that were taking the insurance that was available, and so when we decided that we were going to see only uninsured, we had to change that to say, well, the need that we see in the community now really is for those that are underinsured.
She also notes that one of the great aspects of the Refuge Clinic is that the physicians, nurses, and providers are not bound by the typical pressures of the clinic setting and thus can approach healthcare in a different way.
Refuge Clinic is different in the sense that we do relational health care. We believe that to really see health, you have to treat all components of a person. And so we want to invest in people, not only in their physical well-being, but also their spiritual and their mental health as well. And so we do a very comprehensive approach with a team of lots of different volunteers.
And there is no shortage of demand.
Since we began, we've taken on the care of over 3,500 patients. Currently, we're taking on the care of about 2,000 patients.
This model seems obvious, that you would expect to see it in every community, filling the gaps in a broken system. This is not the case, unfortunately, but Rachel thinks it could happen.
I think that there's an opportunity for other people to continue this type of model, whether it's through a partnership with their local church or whether it's just a group of volunteers that say, you know, we have a combined passion and heart and we want to respond. Everything that we do here is through the work of volunteers. So I can already attest to the fact that there are hundreds in our community that have a passion and desire to care for others. And I know that our community is special, but I know that other communities have that similar passion. And so I think that people just engaging in a unified response would really be able to create things like this in more areas.
Dr. Donna Stanton is a physician volunteer at the Refuge Clinic.
I'm board certified in internal medicine and pediatrics.
She has her own practice and clinic schedule, but regularly can be found in the Refuge Clinic, caring for patients that otherwise could fall through the cracks.
I like what the Refuge Clinic provides to the community, which is kind of filling in the gap for those patients that work hard but may not have access to appropriate or adequate health care and insurance.
Though there are many volunteers from all aspects of healthcare and beyond, it is often hard work to advocate for the patients and get them the help they need.
So we have staff here that works full-time trying to get those procedures done for the patient in an affordable way. Also, we depend on volunteer, pro bono donations, reduced cost benefits through some facilities.
One of her patients is Faith. She has been seeing Dr. Stanton and others for several years.
At the time, I had no insurance, wasn't feeling great at all, nowhere to really go, couldn't afford to go to a doctor's office to see what was wrong. And a family member of mine had told me, hey, we heard of this place, maybe they can help you. I don't know, here's the number, at least go and try and see. I called, they scheduled me very, very quickly.
From her lowest of lows, Faith now understands what the Refuge Clinic has meant for her and her health.
For just the opportunity just to come in and meet with a doctor and tell them what was going on, I truly don't believe that I would be here today.
You see, when Faith started going to the Refuge Clinic, she was morbidly obese, barely able to walk across the room without becoming short of breath. She had congestive heart failure, high cholesterol, high blood pressure, and diabetes, diagnoses that would surely lead to an early death if not treated. Over the years, much has changed, and she credits that to the Refuge Clinic and to how it's a different clinic from what she's seen in the past.
You are at a place where you can just lay it all to the side and it's just like a release. It's just the love. I mean, it's truly just the love of God that has poured over into these people that just make the atmosphere just completely different than any place I've ever been. Even had, at one point in time, never, and I brag about this to this day, that a doctor came to my house because I wasn't feeling great, just to see how I was doing. And what doctor makes house calls in 2017?
The Refuge Clinic has cared for Faith, helping her understand and tackle many issues and improve her health. She repeatedly voiced gratitude and appreciation for those that staff the clinic.
It just seeing that, they're taking the time out of their lives, from their families, investing into people that they don't know to make them get to a point where they feel better. And not just sickness, whatever, but just on the inside, like really, truly on the inside. If it wasn't for them, wow, I would probably still be I'd probably still be stuck on my couch, not able to walk from my couch to my door without being out of breath.
With the help of the Refuge Clinic and others that donated services, Faith has lost over 150 pounds and no longer has heart failure, diabetes, or high blood pressure. She is now pursuing her dream of attending college in hopes that one day she can give back just like those that have given so much for her.
I do. I appreciate you. I do just love you. I love you too.
Surgery on Sunday and the Refuge Clinic are both models that we should be seeing throughout the country. It takes volunteers from all levels, motivation, relationships, and donations to make these projects happen. It can also be assisted by legislators willing to think outside the box to empower those in our communities to do what's right for our neighbors and fellow citizens. If you or others in your community are interested in volunteering with these organizations or want to establish similar clinics in your own community, I invite you to reach out to us here at StantonMD, and we can help you get in touch with those that can make this happen. Contact us, info@StantonMD.com.